What is SCD? Who does it affect? And how the program I've developed manage and cure the disease? All this will be answered in this video I am showing you now. Sickle cell disease is a recessive genetic disorder caused when two parents have a mutated HBB gene. The HBB gene is a recessive gene, which means you need both parents to have the gene to receive the gene, and it also carries instructions for the body to create certain proteins that make up hemoglobin, called globins. By the way, globin is just like something that stores oxygen. Hemoglobin is made up of 4 globins with 2 alpha and 2 beta globins, which causes the hemoglobin to cluster, deforming the red blood cell into a sickle or crescent shape. If you want to remember the shape, you can just use a Turkish flag or like the moon, which greatly hinders the ability for the red blood cell to carry oxygen throughout the body and also increases the likelihood of a blood clot forming. Now, what are the chances of actually receiving SCD? SCD, by the way, is just sickle cell disease. Before I get into this, by the way, there's a difference between being a carrier and full-blown SCD. Being a carrier means you have the gene but you're not affected by SCD, while SCD is an entire package. Imagine a carrier being like a delivery truck passing along a package, while the person that actually gets the package gets SCD basically. The package is SCD. If only one of your parents has a trait, you will not get it. Now, if both your parents are carrying SCD, there's a 25% chance you will develop SCD, 50% chance you will carry the SCD, and a 25% chance you'll be unaffected at all. If one parent has SCD and the other carries SCD, there's a 50-50% chance that the kid will get SCD or carry the trait SCD. Now, if both parents have SCD, the child is guaranteed to have SCD. The long list of many symptoms of SCD include yellowish skin or eyes, extreme fatigue, tiredness, painful swelling of hands and feet, shortness of breath, dizziness, irregular heartbeat, fever, chest pain, coughing, sickle crisis, basically episodes of pain that target the hands, feet, spine, pelvis, and stomach. Infections are more common: anemia, joint pain, delayed puberty in girls, delayed growth, long and painful erections, leg ulcer, stroke, acute chest syndrome, swelling of spleen which causes rapid heartbeat, stomach pain, swollen stomach, anemia as the spleen filters blood, eyesight problems, high blood pressure, and kidney problems which include bedwetting and blood in urine. Hey guys, let's give a warm welcome to our slightly deranged twin brother, Edaz Nafri, who will now be taken over from now on. Hi. For this section, I'll be splitting it up into global statistics and American statistics. Why is statistics so hard to say? The vast majority of all cases are of African descent, with over 98% of all cases being African. Now, you might be wondering why that is, because God probably isn't racist. Now, it is believed to be linked with the disease malaria. Malaria is a parasite that travels and spreads in mosquitoes and has a prevalence of 230 million a year and causing 640,000 deaths a year and a mortality rate of between 50 to 200 every 100,000 infected, and has affected humans since recorded history, which is thousands of years old. Now you can probably see why this is such a big problem, but you might be wondering, how is this linked to SCD? Well, it is believed that SCD has evolved to combat malaria. No one knows exactly how it works, but it has been shown that people with SCD have substantially less malaria parasites in them and recover much quicker than those without it. A few theories attempting to explain why include that lower oxygen levels slow down and interfere with the growth of malaria, and the malaria is a much harder time sticking to the red blood cells, and even if they manage to affect a red blood cell, they are likely to be destroyed by the spleen. All these factors come together to give the body ample time to find, detect, and destroy infected red blood cells. By the way, I'm a little bit sick, so sorry if I found it sound a bit off today. The situation in Africa is what I call the turducken effect, patent pending. A turducken is a delicacy found in the radioactive chambers of Chernobyl. It's basically a chicken stuffed into a duck, and that duck stuffed into a turkey. It sounds like a vegan's kryptonite and is as vile as the bile of an average American. Basically, the turducken effect is two problems. One problem and another problem intertwining with each other. Basically, you stuff one problem to another problem, making that problem bigger, worse, and this problem, you add another layer of complexity to it, which makes that problem worse. The turducken effect for Africa is poverty and an unstable environment, malaria, and SCD. Poverty runs rampant throughout Africa, and paired with the unstable and corrupt politics, access to services like hospitals, vaccines, and other basic infrastructure like water treatment and regulations. A good documentary about how poor water regulations and treatment affects communities is the documentary The World's Most Polluted River by DW Documentaries. Due to the lack of basic infrastructure caused by the chicken, access to malaria treatments and vaccines are much harder, or if not almost impossible to come by, letting malaria run rampant for African communities. If given proper treatment, malaria is much less likely to cause long-term effects. If left untreated, malaria may cause brain damage and may stay dormant in the liver, which may cause poverty as you're left out of work for a while until you recover, and it may even keep you out of work completely due to the long-term effects, notably brain damage. Due to the increase in malaria, children without SCD are significantly more likely to die, leaving only kids with SCD to pass down the gene. Due to the lifelong problems with SCD, it's much harder to find a job, due to all the symptoms I've listed earlier. Even if your community can eradicate malaria, SCD will always be there causing more damage. SCD affects about 100,000 Americans. Around 1 in 365 to 500 African Americans suffer from SCD. Now 1 in 13 carry the gene. 1 in 16,000 to 36,000 Hispanics suffer from SCD. A dietary method called the 3-4-4 method is used to lessen the likelihood of a sickle crisis. The 3-4-4 method is basic and easy, only requiring 3 meals and 2 snacks. 3 stands for breakfast, the dried fruit, fresh fruit, and grain. 4 stands for lunch, which consists of fresh fruits, green vegetables, orange juice, and protein and grain. And the last 4 stands for dinner, which is exactly the same as lunch. And snacks should be fruits, nuts, vegetables, or grain-based like a nut bar or something. The diet should avoid foods high in saturated and trans fat, sodium, and dietary cholesterol. It is recommended to consume lean meats, 5 to 9 servings of daily fresh fruit and vegetable, vitamin C and E, folic, magnesium and zinc supplements have shown benefits. Adequate sleep and regular low-intensity exercises like walking have shown benefits. It is recommended to avoid heavy labor or high-intensity exercises. It is also recommended to avoid extremely high or extremely low temperatures. Now to my favorite topic, drugs. No water. Voxelotor, which sounds like a weapon used by Dr. Doofenshmirtz.
Behold, my I don't care-inator!
The drug was approved by the FDA in 2019 when songs like Bad Guy or Old Time Road were popular. Voxelotor is a drug that's taken orally and suppresses a protein that causes cells to sickle and practically curing the disease temporarily. But there's a bit of a problem. It's fucking expensive as shit. It costs 40,365 euros. Euros, not Australian bucks. That translates to 60,000 Australian dollar dues. And on top of that, that's only for 90 500mg pills. It costs $1,333 per gram. I mean, cocaine does the job for only about $25 to $200 per gram. By the way, there's also an American one that costs about $10K, but it's still more expensive than cocaine. Ibuprofen is an anti-inflammatory drug that is used to reduce the amount of hormones that cause inflammation in the body and to treat fevers and to treat pain. I don't know how, but snorting that sugar actually unblocked my nose. The program I've developed is to make the quality of life for young teens and children better and to manage the SCD and to hopefully eventually cure SCD completely. The program starts with a change in diet, which eliminates saturated fats, trans fats, cholesterol, and sodium. These include fried foods, full cream milk, butter, salted peanuts, processed meats like sausage or pepperoni, and high fatty meat cuts like bacon. The patient should follow the 3-4-4 method I listed earlier, basically 3 meals and 2 snacks a day. You should include dried raisins, low-fat dairy products like skim milk, green leaves like spinach, lean meats like beef and chicken, fruits in general, low-sugar cereals, and whole grain bread. And snacks should be fruits, nuts, vegetables, or grain-based. The 2 drugs I've chosen are Voxelotor and ibuprofen. These are the 2 options you can choose from, with Voxelotor being the more expensive, but it provides great benefits and little side effects. And ibuprofen is vastly more affordable but has a lot of side effects. Avoid grapefruit products if you're taking voxelotor, and avoid alcohol if you're taking ibuprofen. And also, if you have a stomach ulcer, please avoid taking ibuprofen as it may harm the stomach and the intestine. Now for the end goal of the stem cell transplant. After finding a compatible donor, you will need to stay in hospital for a few months, and patients need to be prepared for it. Patients will be put on chemotherapy and radiotherapy for 2 weeks to weaken the immune system and to destroy the affected bone marrow in the patient, and will be monitored closely. After which the patient will receive an IV catheter full of the donor's stem cells, and will be monitored in the hospital for a few months for any signs of rejection, and will be put on immunosuppressant drugs for several months to 2 years depending on the donor. The benefit to this program is that the teen or child won't suffer from the lifelong problems and the episodes of pain or need to buy expensive drugs or drugs with a list of side effects for the rest of their lives. I hope you enjoyed the video.